Dr. Kabaar, what's your update on what is happening in laboratory management?
Well, we're living in an era really where the technology is driving a lot of the changes in healthcare in general, but definitely the clinical diagnostic industry is being influenced by that. When we talk about laboratory management now, it's a lot to do with analytics, it's a lot to do with how we use our data now. We have a lot of it. 70% or more of the information that you find on the electronic medical record is generated by laboratories. So the traditional management tools will continue. People will still ask us to manage our budgets. The finances are still important. But obviously we need to do more with less. This is really the healthcare reform globally. Healthcare costs a lot of money, so laboratory management that generates a lot of the information to assist with the diagnosis obviously has a responsibility to look how we can do that better. So we utilizing tools, the information systems, and over the next 10 years or so, I think we'll see a sea change that we'd like to think that we would lead that sea change, not be afraid of it. And we'll see even some changes in our titles. We'll probably be looking at information specialist rather than necessarily laboratory manager, bioinformatics scientists, data scientists. It will all be part of how we manage our laboratories in the future.
So we will also need new approaches to education?
Absolutely, yeah. I mean, the schools, the colleges, universities that run the biomedical science courses for laboratory folks in particular, definitely the curriculum needs to change to include this kind of information to educate people. We need new graduates who, are specialists in this area, a little bit like the molecular biology era where it was a limited number of people who graduated with that qualification. Now it's kind of a standard course that people can do and choose and major in.
So we're looking at physicians in this context. Are we also looking at technologists in this respect?
I think it's all inclusive, to be honest. When we talk about artificial intelligence, I'm still one of these people who believes it's people who are innovative, not the robots. So the human side of things, will need to continue, but be enhanced. We need to allow the physicians to widen their scope, so it's not just seeing the patient. I hope that continues. I hope we continue to see patients one way or another, whether it's through telemedicine or in person. Connect with the patient, and that's probably the key word in the future, how we connect with the patient now with all the apps available and more of the point of care testing that will happen, that's bringing the laboratory outside of the traditional building, into the homes of people, into the clinics, and so forth. Yeah.
So would you name a few differences between the conditions in the country that you were working in compared to what's happening here in Europe, in Spain?
Wow, that's a leading question, yeah. Look, I think technology knows no bounds, and particularly, I'm living in the UAE where, as you know, we always like to say we have the tallest building and we have the biggest this and that. So we're not left behind, and we certainly like to think we're leading. And Europe, certainly since my younger days, I would think of Europe as the place for innovation, a place where, as a young boy, I used to think of Europe as a high productivity country and efficiency, looking towards Europe. So is that the reality now? I think that's a question that needs to be asked seriously. But the technology will cross the borders, and that's the exciting part. I think that's what will connect the world when we talk about global healthcare and ultimately universal health record. That's pretty exciting stuff, yeah.